In this segment, we'll be chatting with Dr. Douglas Rothrock. Dr. Rothrock is a board-certified interventional cardiologist and internist who's been practicing medicine for over 35 years. Dr. Rothrock also serves as the National Senior Consultant for Ideal Protein of America. In doing my research on this diet, I learned that over 3,000 medical practitioners and doctors across the United States and Canada put their patients on this diet, which suggests to me that this is not simply a superficial fad diet, but it goes much deeper than that. Dr. Rothrock, can you please elaborate on this?
Well, I believe you're really right, Lorraine. Actually, it turns out that this really is a movement, and it's growing throughout the world. If you look at the history of ideal protein, it actually started in Paris with Dr. Tran more than 30 years ago. And it built up in Europe, and then it came to North America about 14 years ago. And it spread throughout the United States, Canada, and the Caribbean over the last 14 years.
Why do medical professionals choose the ideal protein diet for cancer patients?
Well, Lorraine, we want to be careful not to make any claims yet, but one of the issues with cancer cells is that they can only use glucose for fuel. And since they can only use glucose for fuel or sugar, simple sugar for fuel, if you use a very low carbohydrate diet, you essentially starve the cancer cells. So that's its theoretical use in cancer.
I've actually been told, seriously, that women who are trying to get pregnant should go on the ideal protein diet. Doctor, is this really true, or is this just a hype?
Well, actually, there's a great deal of truth to it. If you look at North America, polycystic ovarian syndrome, or PCOS, is actually the most frequent cause of infertility in women. That's happened in the last 20 or 30 years. And PCOS is related to what is known as the metabolic syndrome. Metabolic syndrome is a collection of issues that occur with obesity, such as high blood pressure, prediabetes or diabetes, hyperlipidemia, and central obesity. They're all tied together with insulin resistance and hyperinsulinemia. Insulin, of course, is the anabolic hormone related to carbohydrates. And one of the treatments for PCOS is to utilize a diabetic medication called metformin. But we can substitute for that by the ideal protein protocol, which dramatically lowers insulin levels because of the low carbohydrates. So it allows the same sort of treatment, and we have a lot of what we call ideal protein babies throughout North America. In Chicago, are you familiar with in vitro fertilization?
Yes, I'm familiar with that.
Yeah, in Chicago, in one of the largest in vitro fertilization clinics in the United States, there's an ideal protein clinic. And the ladies that would like to be pregnant with in vitro fertilization, which of course is very expensive and not paid for by insurance,
yes,
they encourage their patients to do ideal protein first.
Being an interventional cardiologist, I'm sure you've seen your fair share of cases where women have unfortunately died from strokes and other forms of heart disease. What will you say to women out there who may not have much interest in this topic, or may say, it may never happen to me, bearing in mind that heart disease is the #1 killer of women in the Caribbean and North America?
Boy, I think your point is right on, Lorraine. As a cardiologist, men are pretty straightforward in cardiology. Women are not straightforward. In fact, the American Heart Association this last week actually put a statement in the guidelines suggesting that women's symptoms are not as easily identifiable as men's symptoms, male symptoms. So, it's very true, and I see it every week, that women present with very unusual symptoms. They present with symptoms that are certainly different than men. And a lot of the data, of course, over the last 100 years has been collected on men, and more data needs to be collected on women. But I can tell you that I think you women are tough. I think men are kind of wussy, I think, and women are really tough. So I think that's what ends up with them ignoring symptoms, I think, a lot more than men do. But almost any kind of indigestion that happens with exertion, pressure in the chest, unusual symptoms in the jaw, shortness of breath, a reduction in exercise tolerance for no particular reason. Those are the kinds of symptoms that I see that women present with. The other thing that I think is really important is that symptomatic coronary artery disease and even heart attacks can occur in women under emotional stress. And emotional stress turns out to be a very important part of women's presentation. Again, unusual for it to present in men, but very common in women. There's even a cardiomyopathy called Takasabu's cardiomyopathy, which is related to women's stress. So, I think that if there's any of these symptoms in a woman's life, she really needs to get it checked out. It is the #1 killer in North America for sure. So to think that it's not going to happen to you is statistically maybe not the case.
And doctor, you're so right, because we tend to underestimate the impact of stress in our lives, because we've come to accept it as so normal, but it really can impact the heart. And it's scary.
Correct. It is. And in fact, and a lot of times it will strike women out of the blue when they had no idea that a particular life emotion that's happening to them, a death in the family, a death of a child, those sorts of things can precipitate these sorts of symptoms. So they really need to pay attention to it. The fact that women can get a broken heart isn't exactly a myth.
Wow. So have you ever seen cases where stress directly contributed to heart disease?
Last week.
Really? Can you elaborate?
Well, I had a middle-aged woman who had a death in her family, who was extremely having a great deal of difficulty dealing with it, and she was going to have to close a bunch of issues here in town and travel to the funeral, and she developed a heart attack with normal coronary arteries. So yes, it happens occasionally, and that was what we would call an emotionally related heart attack. So those are the kinds of emotions and situations that occur. Fortunately, those kinds of heart attacks do have a good prognosis if treated early. So it is a good prognosis heart attack, and women tend to do very well with it, and if subsequently treated properly, can be prevented in the future.